If you're open social media in the past year, you've seen Ozempic, GLP-1s, celebrities are taking it, your neighbors are taking it, your co-workers are taking it. These medications have completely changed the conversation about weight loss. But here's the question nobody seems to be asking. What happens after the weight comes off? Today, we're talking about the good, the bad, and what every patient needs to know before, during, and after taking GLP-1 medication. Welcome back to Living a Full Life podcast. I'm Dr. Enrico, and this week we're going through GLP-1s a little bit deeper. Why is everyone talking about Ozempic and everything else? The current GLP-1 statistics is that 1 in every 8 Americans right now, 12% of Americans report having used GLP-1 medication such as Ozempic, Wegovy, Mounjaro, Zepbound for diabetes, weight loss, or another chronic condition. Last year when I did this podcast, it was 7%. Among adults aged 50 to 64, current use is roughly 22%. They're the biggest users of it, making it one of the highest groups that are using it. More than 25% of adults with diagnosed diabetes now use GLP-1 injectables. And analysts project 30 million Americans could be using GLP-1 medications by 2030. This isn't a fad anymore, like we were talking about a couple years ago. This is one of the biggest shifts in medicine we've seen in decades. Since probably the last one is statins, the movement of statins. And they're still around, right? So this is why we're doing the podcast. What is a GLP-1? Oh, no, I'm not answering. I'm asking you. What is a GLP-1? For those 12% of you using it, please answer this question for me. That's what I thought. You don't even know what it is, but you put it in a syringe and inject it. That is insanity to me. You don't even know what it is. You'll take it. But you also put vaccines in your body too. So we'll get that into another day. You don't even know what's in that vial, but you put it in you. I'm not against them. I'm just saying we put these injections in with trust from our providers, but our providers get that stuff from pharmacies, hopefully. And we just hope, at least we hope they're sterile and not going to kill us, right? That's the whole hope. But you need to know what they are. It's a hormone your body already produces. It's produced in the gut. Your gut produces a lot of hormones. We've talked about these in the past. But GLP-1s and 2s and 3s are all produced in the gut. It helps regulate hunger, sends messages back to the brain saying, hey, we're full, we're stretched, we're distended, we've eaten. Get rid of the appetite and the hunger sensation. It gives us fullness. It regulates our blood sugar. It tells insulin, hey, do your thing. It triggers the stomach to empty into the intestine. It creates the insulin release cascade to the pancreas, and it signals to the brain for appetite and all those things. Your brain literally stops obsessing about food when GLP-1s are injected into the body. People often say, I just don't think about food anymore. This is real. That was the purpose of it. Actually, the purpose was insulin regulation. That's where they all started. And it was very effective and is very effective. But then there's some other things that goes on too. So if it's telling the brain certain things like about appetite, are we sure it's just telling the brain about appetite, or is it influencing it about other things too? Is there an appetite spot on the brain exactly for appetite? No, it's conjuncted in the midbrain with a bunch of other stuff, and it affects that area. The good news, we got to give them some credit. GLP-1 medications produce meaningful weight loss. The results are pretty, I mean, if you look at the numbers, people are losing weight. It improves blood sugar control. Blood sugar goes down, blood glucose goes down, and A1C goes down. It reduces cardiovascular risk in appropriate patients. It improves sleep apnea through weight because of the weight loss. So then now we have a sleep apnea pro there. It reduces joint pain by reducing overall body weight. Everything's a conjunction to loss of, look at all the stuff they get to say. Once people lose 40 pounds, what happens? Their joints feel better, they sleep better, they breathe better, they move better, they have better energy, they have better will, they have better mood. So now they're like, GLP-1s can boost your mood. GLP-1s can reduce joint pain. No, that's not true. GLP-1s help reduce body weight, which have a huge effect to a lot of other things, which is great. This isn't cheating either. If you're on them, Don't feel like you're cheating. This is a tool. Obesity is a chronic disease for many people, and these medications are an important medical tool. It works, especially in the West, in North America. I mean, the obesity rates are out of control. This is solving that issue. It really is, kind of. This helps you this helps you lose weight with it as a tool. The problem that no one's talking about is this is the heart of the whole weight loss journey. Weight loss does not equal healthy weight loss. We don't talk about it. Putting on a garbage bag, get on your whole body, standing in a sauna, and then running on a treadmill at the same time, sweating profusely to try and lose weight off the scale isn't healthy weight loss. That's dehydration. You're really pushing all the fluid out of your body so that on the scale, you weigh in at a certain amount. Typically, this is in fighters and stuff like that need to weigh in for a fight. Stuff that they do. That's not healthy. So we got to talk about, is this healthy weight loss or not? And with weight loss comes all weight is lost. Bone mass is lost. Muscle mass is lost. Organ mass is lost. Fat loss. It's a whole unit. You can't just target fat. So bone density, strength, everything is lost when we lose weight. So if you're not actively protecting your muscle, you're losing part of your metabolic engine in this, just like any weight loss program. Muscle loss is a big problem. Recent research has shown at a major endocrine meeting also suggests many people become less physically active on GLP-1s, making muscle preservation even more important. And it's because they're losing the weight and don't feel like they need to be active because the weight's coming off. And it trains us into thinking, oh, this is easy, when it's not. We know it's not. It's never been easy to lose weight. You've been on weight loss journeys before. Diet and exercise, diet and exercise, diet and exercise. Now GLP-1s are changing the game. Why muscle matters. We talked about this last week on the podcast. It burns calories. It improves insulin sensitivity. It protects the joints. It prevents falls. It supports healthy aging. If you lose 40 pounds, but 12 of those pounds are muscle, do you actually become healthier? This is where I want to go with this podcast. Get you thinking a little bit. If we sacrifice 12 pounds of muscle, at the end of this journey, whether it's 6 months, 12 months, whatever, are we healthier? People are going to debate me and say, well, yeah, we lost 50 pounds of body weight, 40 pounds of body weight. We're better off. I'm like, oh, I don't know. Now the metabolic engine's down. How are we going to build 12 pounds of muscle? Do you know how long that takes to build 12 pounds of muscle? 5 days a week at the gym, working out. It takes over a year to build that type of muscle. So here are 4 things every GLP-1 patient should be doing if they're on them. So if you know someone, if you love somebody that's on it, great, support them. Support them with this information. You got to aim for roughly 0.7 to 1 gram of protein per pound of the goal body weight. So if they're on a weight loss journey, let's say they want to get from 200 to 160. 160 grams is the base minimum for protein. They need to be eating that even if they're still at 190, and their goal is to get down to that. Minimum. I'd be eating the body weight if I could. But as we're losing weight, we're on GLP-1s, we don't want to eat much. So it kind of helps them when they're not 190 pounds to eat less 30 grams of protein at their goal weight to the 160, because 160 is easier to consume. And we want to adjust this for age, kidney function, and activity level. We got to make sure, doctor supervised is always the best way to do this. Why? Because our appetite's low. So we need to focus on that protein first. Protein is usually the first thing patients stop eating because it makes you feel full quicker. Number 2, you got to lift some weights when you do this. You got to do some resistance training. You may not have the energy to do, full out cardio sessions, but you need to lift weight. Resistance training. Muscle is your metabolism. You got to keep telling your metabolism to keep working. Muscle is longevity. As you shut those 2 things down with muscle, you're just training your metabolism to be weak. And then once you get off the GLP, because you have to, first off, they're expensive. You're going to budget this for the rest of your life. Come on. Number 2 is once you get to your goal weight, any good provider that's providing your GLP-1 should tell you, okay, you're done. This is how you get off. They should low dose you off. So you're going to be off at some point. You need to understand that. So maintain your metabolism. Number 3, stay active. Walking, golf, swimming, hiking, pickleball, whatever keeps you moving, keep doing it. One concern is that some people unintentionally move less because they feel fatigued or assume the medication is doing all the work. Don't fall, don't fall for that. Have an exit strategy. This is huge. Are you planning to be on the medication forever? And everybody I ask says no, because that's the logical answer. We want to talk about lifestyle afterwards. We want to talk about nutrition. What's that look like afterwards? And during. Why cheat and create bad habits during the journey? Create good habits while you're losing the weight. Exercise, stress, sleep, long-term habits. What do those all look like once you're off? Start now. Start creating those habits now. Medication should support healthy habits, not replace them. Full stop. I support that. That's why I do what I do in my career as a chiropractor. The one thing in our scope of practice is we cannot prescribe drugs. And I love it. I love my job. I love everything because you figure out how to live healthy without them. And that's the whole point of this. Medication should support healthy habits, not replace them. Here's the biggest mistake I'm seeing and have been seeing. I'll just eat less. Well, it's going to force you to eat less, and that's wrong. Instead, we should think, I'm eating less, so every bite matters more. Every meal prep matters more in what I eat. And I love it because the GLP-1 people that are doing this are setting themselves up for such great success afterwards. Because now they're meal prepping, their grocery lists are changing, their shopping habits are changing. They're going to create lifelong habits. They're not going to be able to deviate back to old habits as easily because they've created new habits. People who are just sticking with their old habits and using GLP-1s and getting results are going to fall back and gain all the weight back. I've already seen it. So we want to be talking about micronutrients, still doing our supplements, still doing a multivitamin, still doing vitamin D, still taking supplements during this. Fiber, eating our fruits and vegetables, hydration, still got to do that, strength training, and prioritizing sleep. So if we do those, we're going to create great future habits. But what does the future of weight loss look like? Oral GLP-1s are coming out now. You can get some of them orally. Ozempic has an oral one. That's got to be prescribed, and you got to be diabetic for that one. So they're oral now, easier. So now it's even easier to consume, right? Some people don't like injecting. We have triple agonist drugs in development, which means the stacked GLP-1 triple effect that they can do, and not just the one hormone. They can triple this with 3 hormones. So you get all the benefits of a GLP-1. You get increased fat loss as the second tier and improved muscle retention as a third tier. It sounds superhuman, but they're being developed right now. They're being developed. Retatrutide is one that's out right now. It looks like the superior GLP-1 that you can get right now. And that's because it's doing some pretty cool stuff. And they're only going to get better, which is crazy. They can do personalized obesity medicine for people. So they're going to have an array of peptides that they can use specific for certain people, which I like because now it becomes more targeted rather than broad-based. And better body composition monitoring will only help this move forward better. So I like where it's going. It's pretty cool, but it's too techy and still the unknown. We don't have any research to show human trial. You are the human trial right now. We're getting data on you to see what your results are, and that's how we're learning. If you drop dead, then you're a statistic. That's not happening. We will become healthier, or will we just become lighter? That's my question. And I think it's the later. I think we're just going to become lighter, and I don't think we're really creating healthier habits. So my perspective as a clinician is I don't think GLP-1 medications are bad at all. In our office, we are divided into a functional med side and our chiropractic side. I control the chiropractic side. Our functional med doctor team with an MD controls the other side. They do peptides. They do all the peptides. Anything you want, you can get it there. And I get to talk to him. He's a level-headed doctor. He's wonderful. I don't think they're bad at all. I think they're an incredible tool. Scientifically, they're an incredible tool. But tools don't build houses by themselves. A hammer doesn't build the entire home. The person using it does with all the tools. And these medications should be helping you build a healthier life, not replacing the habits that keep you healthy. So we do tons of weight loss management, no GLP-1s, no processed foods. We've done this for years. I see that side of it. and I see how it works. It works fantastic because what we're doing is permanent habit changes for the patient for the rest of their life. They just now know, yes, I'm almost 50, or I am 50, or I'm 60, whatever it is, or I'm 38. I got to change the way it is. I got to eat like this. This is what I'm going to do for the rest of my life. And I'm like, there you go. You're going to maintain a healthy weight for the rest of your life, and you're going to be healthy for doing it. And that's what I'm trying to support with this. GLP-1s can be the hammer. They can be the hammer. You need the hammer to build the house, but you also need a bunch of other tools and habits to maintain the house and complete the house. So I'm going to ask you a couple questions for your weight loss journey, or the people you love and you're listening to this for. Am I eating enough protein? That is the most important question on this whole thing. Am I lifting weights at least 3 times a week, doing some resistance? Am I walking every day? Am I sleeping 7 to 8 hours a night? If I stopped my medication tomorrow, my GLP-1, would my habits keep me healthy? That should be the end question of this journey. Is like, what did I learn on this journey? I lost 50 pounds. I feel great. I'm doing great. I'm so proud of myself. I'm going to stop this medication next week or in the next 4 weeks. Would the habits I'm doing now keep me healthy onward? If the answer is no to any of these questions, or some of these questions, the medication is carrying more of the load than your lifestyle is. And that's a huge red flag from your doctor's perspective. GLP-1 medications may change your weight, but only your habits change your future. The healthiest people aren't the ones with the smallest waistlines. Trust me on this. They're the ones with the strongest bodies, the healthiest hearts, the best relationships, the best moods, and the habits that they can sustain for decades. If you're taking GLP-1, don't just lose weight. Build a healthier human. If you enjoyed this episode, share, like, comment. Thanks for joining Living a Full Life. And if you have any questions, you can always reach out to us, info@fulllifetampa.com. We'll help you no matter where you're at. Our programs run virtually and in-house, and we can help you in any way, shape, or form when it comes to your health, except for drugs. If you want medications, talk to your medical providers for that. But for everything else on longevity, vitality, living a healthy life, I feel like we have a good foundation to help each and every one of you and your loved ones. Stay well, stay healthy, take care.